Immediate Full Arch Restoration DM2 Guidelines Provisional Hybrid Prosthesis Conversion. In this instructional video, we will demonstrate how to execute the Provisional Hybrid Prosthesis Conversion for an immediate full arch restoration case. Prior to the steps shown in this video, 4 tapered implants were placed in the maxilla following the DM2 guidelines. Primary stability was obtained on all implants and the appropriate low-profile abutments were selected and seated. In this instructional video, the stone model will replicate the patient's maxillary arch. For additional details, please reference the DM2 guidelines. A new provisional prosthesis was fabricated for the treatment. Fill the anterior portion of the provisional prosthesis with heavy-body VPS impression material or quick-set occlusal registration material. Seat the prosthesis into the mouth. Use the palatal portion of the maxillary prosthesis to accurately and completely seat the prosthesis. Make sure the dental midline is consistent with the facial midline. Have the patient close into centric occlusion. Let the VPS impression material set in the intaglio surface of the prosthesis. Remove the provisional prosthesis. The locations of the abutments have been recorded in the impression. Drill holes into the prosthesis at the abutment locations identified in the impression. Continue drilling holes at each abutment location. Remove impression material from the prosthesis. Using a fine crosscut or similar style burr, drill each hole slightly larger than the diameters of the low-profile abutments. Seat the prosthesis into the mouth. Mark areas of insufficient clearance over and around the low-profile abutments to allow for passive seating of restorative components and adequate acrylic resin. Enlarge holes further as marked. Seat the prosthesis into the mouth once again to verify clearance and passive seating. Place one low-profile temporary cylinder onto the low-profile abutments. Seat the prosthesis into the mouth and verify that the prosthesis is not coming in contact with the low-profile temporary cylinder. Place the rest of the low-profile temporary cylinders, making sure that all of the cylinders are completely seated onto the abutments. Try in the provisional prosthesis over all the low-profile temporary cylinders and continue to remove the acrylic resin from the holes as necessary. The provisional prosthesis should not contact any of the restorative components. Evaluate the occlusion to verify that there is no interference from any of the cylinders when the denture is fully seated. If one or more cylinders interferes with seating, mark them and reduce their height only enough to clear the opposing occlusion. This must be done extraorally. Once the low-profile temporary cylinders have been reduced to the appropriate height, seat the provisional prosthesis intraorally. A rubber dam is utilized to cover the surgical sites so that the acrylic resin will not come into contact with the incision or sutures. This will separate the surgical and prosthetic fields. Using the impression material, mark the location of the abutments and cut a piece of rubber dam to follow the curvature of the maxillary arch. Punch holes at the implant locations using a rubber dam punch so that the rubber dam fits securely over the low-profile temporary cylinders. Place the rubber dam over the low-profile temporary cylinders. The apical portions of these cylinders have been machined with concavities to retain the rubber dam. Place an access opening filler, like cotton, inside the cylinders to prevent acrylic resin from entering the access openings during the pickup procedure, and prime the denture. Combine monomer liquid with acrylic powder per the manufacturer's instructions. Load a monojet syringe with a thin mix of auto-polymerizing acrylic resin. Intraorally, inject auto-polymerizing acrylic resin around the temporary cylinders. Have the patient close into centric occlusion. Make sure that the provisional prosthesis is positioned properly. Midline, occlusion, and vertical dimension. Let the acrylic resin completely polymerize. Remove all access opening fillers from the temporary cylinders. Unscrew the screws and remove the provisional prosthesis from the low-profile abutments. Remove the rubber dam. Mark flanges, pallets, and cantilevers to visualize areas that need to be removed. Remove flanges. Remove the pallet. Remove cantilevers and excess resin. Round all sharp edges around the temporary prosthesis with a denture carbide burr and a polishing burr. Adjust the heights of the cylinders to conform with the palatal and occlusal surfaces of the denture. Using a thin, rounded tip burr, ensure the access openings are cleared for subsequent placement of retaining screws. Place low-profile abutment polishing protectors into the temporary cylinders inside the provisional prosthesis. With all polishing protectors in place, fill any voids around the cylinders with auto-polymerizing acrylic resin. Allow the resin to polymerize and remove the low-profile abutment waxing screws and polishing protectors. Using a polishing point, remove excess acrylic flash. The provisional prosthesis is now finished. Proceed to seat and complete the fixed provisional prosthesis according to the DIEM 2 guidelines.